Welcome to the portal walkthrough video where I will show you how to find information about your account and how to find information about your patients. These are probably two of the more important features you're going to use when you're in the portal. So the first time you access the portal, there will be an account settings screen that will prompt you to add any information that we require that for some reason was not included when your account was created. If for some reason you do not see this screen the first time you log in, you can go up here to the far right corner of the screen where your name is or your clinic name is and click on settings, and it will take you to this page. Once here, you'll notice that there are some fields that are required. Anything with a red asterisk is required information, and if there's information missing from those boxes, make sure that you fill that in. We will have filled in the billing information and anything pertaining to phlebotomy and patients that you have selected when you created your account. If you are not client bill, but you need to switch to client bill, you will be required to enter payment information to have on file so that when test results are processed, we're able to bill you for those. If you are patient pay, then you don't need to set this up if your patients are paying Vibrant directly. If you need phlebotomy services, if you're using the patient connection program, and the patient connection program is if your patients are going to call in and talk to Vibrant's clinical team to discuss their results and diet, lifestyle changes. This is not what providers use to call in. If you've opted out of the patient connection program, you, the provider, can still call in and use that service to talk to our clinical team. And then if you have turned off report access to your patients, for instance, if you do not want your patients accessing their reports before they come back into your office to see you, we have that feature turned off. So you will see all of this information that's been set whenever you opened your account. If all of that looks good, you're just going to hit submit. And then there's also a way to customize your portal view whenever you do look at your patient tab, which we're going to go to next. You can also check this feature here, send blood kit to patient always. This is an important option if you see primarily remote patients, or if you do not do phlebotomy in office and your patients are always going to go somewhere else to get their blood drawn. We will ship the blood kits to the patient, which is not standard practice unless you notify us. Otherwise, all kits for blood testing will be sent to your practice address. So for instance, the food zoomers, food sensitivity, neural zoomer, those kits will all by default go to your practice address unless you specify otherwise. So you would want to make sure that you have the right information selected here. If that's all fine, you're going to make sure that you click confirm. The next information that's going to be really important to access is your patients tab. So if you're brand new to Vibrant and you have not placed any orders yet, you won't see any patients here, and you won't be able to create a patient until you place an order for that patient. So there's no way to preload patient information until you place an order for labs for that patient. Now, once you even create a draft, your patient drafts will be under this button here where it says patient draft. Anything that has been ordered, though, would be test ordered. Important information that you want to note is you're going to see your patient's name, age, date of birth, gender, address, phone, email, last date of service, and then this flag will indicate anything. You know, if you need to flag this, this is a feature that you would do that maybe perhaps you want to come back and look at this information or remind yourself. There will be a number of indicators up here that will give you some options here as far as what you can do with each patient. So the first thing would be order tests. If this is a patient, obviously this patient already exists if they are down here in this table. If you're going to order additional testing on an existing patient, perhaps this is 3 or 4 months after an initial test order and you want to go in and order more tests for them, if you click on that button, it's going to take you to the screen where you can order more testing, and their information will pre-fill into the patient order screen. You'll also notice if a patient has not paid for their testing. So for instance, if you are not set up as clinic bill and your patients are paying Vibrant directly, there will be a little red indicator here that says pay. And this is where if your patient is in the office with you or you have them on the phone and you are trying to access their labs, but you can't access them because they haven't been paid for, you can go in here and you will see information pop up where you can enter a payment information and hit pay. Immediately it releases the labs to be viewed. So you will see that button there if your patient has not paid for the invoice that is sent to them. In progress just indicates that of the tests that were ordered, not all of them are finished. And received means that the sample kits have been received by the patient. And this information is a new feature that you can go in and see that the kit that we sent to the patient, the tracking ID here, and then the return tracking ID here. So that way we know that this has been sent to someone, what their address is, and whether or not it has been received by the patient, and then whether or not the sample has been received by Vibrant. So that's going to be very important information that you want to keep track of. Now, if we want to go in and we want to look at our actual patient, what has been ordered, keep in mind if it says in progress, you're going to get a little dialog box that pops up that says that lab data is incomplete, and these are preliminary results. Okay, up here at the top right screen, it will tell you how many tests of the total ordered have been completed. And this is total markers. So for instance, if you have ordered the gut zoomer, there are 308 markers total on the gut zoomer. So if nothing has been completed, it will say 0 tests of whatever. And so what else you can see down here is if you forgot, for instance, what you ordered on a patient, you can scroll down and you'll see on these tabs what was ordered. You will see this message here, payment missing, if this patient has not paid the invoice yet. Again, all it requires is to go in and enter payment information, and the results will be released if they are in fact completed at that point. From this screen, you can access the completed reports a couple of different ways. You can view the reports here once they're completed, and then you can also view them here. If you go under View Report, then you have an option between Complete Lab Report and Lab Summary Report. Summary report is only going to give you a few pages of each report that gives you some basic information. It doesn't give you all of the clinical comments as well as intervention comments and the tables and resources in the back of the report. Complete lab report gives you all of that. So it's up to you which one you want to do. You'll also notice that there are some additional options over here as well. Here again, once you're in this patient's profile, you can order additional testing. You can look at other samples that you've ordered for this patient by date. You can see an order summary. This, of course, is going to give you the requisition form, essentially. You can request redraw. For instance, if your sample was TNP'd for some reason, perhaps it wasn't refrigerated or the wrong tube was drawn, you can share the patient portal. And this is a really useful tool if you are getting ready to see your patient in just a few minutes, and you know, or your patient is going to be in the office and they haven't had a chance to get in and look at their results. You can go in and put their email in and then click share to email, and it will send that patient a unique key that they input and verify who they are based on the information we have for them, to prove that they are that patient before they access their portal. You can also share the order summary, which again is the requisition. So for instance, if the patient is going to go get their blood drawn and they do not have a copy of that, and for whatever reason you don't or it didn't come in their kit, you can share that and they can print it or give it to the phlebotomist. So those are the basic features, how to find information about each patient and how to figure out whether the tests have been completed. And you'll see that for each of the patients that you have in your portal.